Hi everyone, my name is Medel and I'm a registered nurse. And over the last 3 years, my team and I have helped over 7,000 patients use cannabis. Now, the story of how I became involved in the cannabis space is a pretty interesting one. It all started a couple of years ago when I first graduated from nursing school. I had finally obtained my degree and I was excited to get my career started. Fast forward some time, I ended up going back to school and I was taking a couple cardiology courses. And while I was taking one of these courses, I ended up meeting a nurse who told me that she was working in a medical cannabis clinic. She started telling me about this little startup called GrowWise Health. And she was working one-on-one with her patients to create individualized treatment plans for her patients. I was immediately intrigued when I heard this. Cannabis was always something I was interested in, but it was never something I thought I could really pursue in my nursing career. I mean, it was never something I really learned in school. But I liked the idea of working in a non-traditional healthcare environment. I wanted to help people, and I saw the potential here, so I jumped at that opportunity. Now, within the first few months of when I started working in this clinic, I quickly realized that this was a very new industry. Resources for medical cannabis were really limited, so we were working to obtain the most accurate and reliable information we could give to our patients. But we had a really great team behind us. We had a very qualified team of physicians, nurses, healthcare providers, and we were all very like-minded individuals. And we believed that if used properly, cannabis could be a very effective treatment option for patients. We followed all of the rules. We helped connect our patients to Health Canada regulated licensed producers. We helped our patients make proper strain selections for their symptoms. We helped them with dosing guidelines, and we helped connect them to the proper modes of administration that best suited their symptoms. But most importantly, we were giving our patients support. Support in knowing that they were obtaining their cannabis from legitimate resources. Support in knowing that our patients had a team of healthcare providers behind them each step of the way to ensure their path to success. We were really working to break down stigmas here, and we were really working to validate the potential that cannabis had as a medication. So my moment of realization here, or what I'll call my aha moment, was when patients started coming back and telling me that they were finding symptom relief. And these were patients who were experiencing their chronic conditions and symptoms for years. And they had already tried and exhausted all other forms of traditional medications and therapies and treatments, but they weren't finding relief. So when they were coming to our clinics, they were really coming to us almost as a last resort, just desperate to find anything that helped them. So we worked with them and we helped put them in the right path. When patients started coming back then, saying they were finding relief, that's when we saw this was something big. When I had one of my patients come back to me for a follow-up appointment, and she told me that after 10 years of being on opioid medications, Zopiclone for chronic pain relief, and finally when she started using cannabis, she started noticing improvements. That's when I realized that this was something huge, and this was a big deal for her. And I really saw that there was a big potential here, and there was a big potential that cannabis has in the healthcare system. Now, looking forward, cannabis does have incredible therapeutic potential. We're really starting to see more information and legitimate studies and resources coming out exploring how cannabis can be used effectively. And this is great to see. And with all this information coming out, it's causing patients to really start to ask the question, could cannabis be right for me? So with all this information, it's great, but we still need more. We still need more information, more studies coming out to support its potential here. And it's time that we really start looking at the potential therapeutic properties that cannabis can provide. So we really need to start talking about it. So what do we need to do? Healthcare providers need to become more involved and more understanding in talking to their patients about cannabis treatment options. Because the reality is, patients are asking about cannabis. Patients are coming to their clinics and they're asking their doctors and their nurses and their healthcare providers for options. And if we can provide them with that information, we will be doing something right. Patients want our help and patients need our help. There's still a big stigma with cannabis, and we're working to break down those barriers. A lot of the patients we see in the clinics are completely new to this, so they're trying to navigate this confusing system. Patients don't need to get high with cannabis. Patients can use high CBD treatment options and find effective non-psychoactive relief. So we have an incredible opportunity to make big differences. So with additional research and product development, we have an opportunity here to start using cannabis as a first-line treatment option rather than the third-line treatment option. We need to help give patients more information so they can make informed decisions and really advocate on our patients' behalf. We have a responsibility to our patients to have those meaningful conversations. And if we can provide them with that adequate information and give them those support systems, they'll be more likely to succeed with this treatment. This really is a shift in healthcare. And it has an incredible opportunity to help patients, but patients can't do it alone. So this is a call for action. We need to get more involved. We need to work together. We need to start talking about cannabis more openly and freely and break down those barriers, because this really is an incredible innovation in healthcare. So let's embrace it.
Thinking about learning more, we have time for 2 questions, just 2. But if there's questions for Sarah, we'd love to take them now. And don't be shy, there is still stigma around cannabis use, certainly around the medicinal side. So if there's questions, raise your hand, there's a microphone. And if you're too shy to ask, Sarah will be around. Yeah. But if there are any, yes, this is what she does. She answers really difficult questions. I see 2 hands. I can't see anything, but I do see 2 hands.
You were fantastic, first of all. So please, no, seriously, that was very, very well done.
Thanks.
So being a medicinal user myself, one of the biggest things I struggled with was kind of like the gateway from CBD to starting to dabble with a little bit of THC. And it's a really interesting topic because people are very scared of getting loopy and getting crazy and losing control of themselves, and they don't realize that there's a big stigma around not. How do you approach that when people have started to come in, they've gotten their license, they're starting to like transition into it and say, I want to get a little bit of that high that people are talking about?
Yeah. So that's definitely like a great point. So when we see our patients in the clinics, when we're assessing them, we'll talk to them and say, if you're new to cannabis, we really want to start our patients on a low and slow treatment plan. So we'll start them off on low dosing guidelines, because the reality is patients respond differently, you know, so
highs
like
are
any
subjective.
kind of medication.
Yeah.
So we'll start them on that low and slow treatment plan, and we'll give them the resources to titrate their dosing upwards based on how they're responding, really monitor for symptom changes, side effects, improvements. And then as they become more comfortable and they start to feel more confident in how they're responding to the treatment, then we'll start to incorporate more like low doses of THC and start to slowly work that up over time, because THC can definitely provide great relief for patients, and we'll combine it with CBD options to kind of reduce and mitigate the psychoactive effects of THC, but doing it in a way that's really going to get them to where they need to be. So it's a slow and low process.
Thank you.
Yeah.
Hi, so I have a question. So you mentioned that medical cannabis should be the first choice in medication options. So I have 2 questions actually. The first one is, if it's the first option and patients are not treated with other conventional medicine, how would you mitigate the risk when they travel, especially that it's not regulated in many places, in many states, and usually people who have chronic illness are the ones who are treated with medical cannabis. Second is, the issue, so I'm talking from a patient perspective. The issue with medical cannabis that I see from my perspective is not it's not the regulation, it's not everything. It's actually when a patient go in, you only have an option to be in one dispensary, one licensed provider. You cannot experiment with small doses. You have to buy a big amount. You cannot renew your license without ordering from a licensed producer. So I think the regulation of medical cannabis is making people go to more unconventional sources and go on leafly and weed and find people who have exact information of what they're doing that medical industry is not providing for them.
Yeah.
So third thing is, when you experiment with something and finally you have it, if you want to go and produce it by the license time to renew, you're not going to find it. So you're going to wait until it's available, or you have to move your prescription.
Okay. So you made a lot of good points. But you know, with that question, you know, it's a big question, but when patients are coming in and getting the right resources to make those informed decisions, if they're getting that information from reliable resources, they can start off using a strain that would be best suited to their symptoms. So they're not trying something that doesn't really make sense for what they're coming in for. But when it comes to like more like traveling and using other conventional medications, that's where we really need to look at more changes, and where we still have a ways to go with that. And it's just going to take change, more advocacy, more patient, really getting that information out to patients, and healthcare provider education will start to slowly put us towards that path, but we still have a ways to go. Yeah.
Great. Thanks, Sarah.